Hello everyone. So in this session we are going to focus on familial cancer and or otherwise we can call it as cancer genetics. So with the word cancer itself it's pretty showing up the how it is impacting through genetic might be purely we when we study about the cell cycle and all we'll be seeing about or focusing about the oncogenic gene and how it is mutating and how it is developing the cancer cells onto a child. So in genetic counseling how it is going to help us, so this cancer can be easily identified just by screening, or you can just look into the genetic makeup of the child, or even in the intrauterine life you can identify and you can prevent certain developmental of cancers. So the caution sign of cancer, we all know that it is caution, so change in the bowel or bladder pattern, a sore that does not heal, unusual bleeding, thickening in the lump or anywhere else in the body, obvious change in the water hormone, and the child will be having or the adult may have defects in the nagging cough or hoarseness. So how we can identify this cancer, since it's mainly due to it's still on a big history that in ancient Egyptian fossils they have found that it is purely due to the cancer cells which is being either it is causing ulcer or non-ulcer. So they call it as carcinomas or carcinomas. So these words are being coined by the great physician Hippocrates, and he have given that cancer is nothing but it is the abnormal proliferation, or you call it as uncontrolled growth of cells which disrupt the normal tissue function, and it causes potential harm to the body. So these cancer cells either it can be benign or it can be metastatic, that is, it is going from one side to the other. So depending upon the type, the different therapies will be given to each client. So this cancer, as I told you, the caution. The next two major symptoms or early signs would be pernicious anemia and unexplained weight loss. So, what can be the major etiological factor beyond causes, or you call it as behind cancer developing cells? So, either one is due direct exposure, that is to physical UV radiations, or might be due to biological exposure such as bacteria, viruses, or parasites, or it can be due to exposure to chemicals such as arsenic, alcohol, or components of smoking, tobacco smoking. So these will be the predominant causes for developing cancer. But there are also the other works behind it. So how it is the pathophysiology, how the physiological process of cancer leads in. So from the picture you can see that there is mutation is getting inactivated, and you can see the tumor suppressor gene is being activated, which causes cell to multiply 1 into 2, 2 into 4, and like that it grows very abnormally. And you can see that the mutation will inactivate the DNA repair gene, which causes more and more prototype of oncogen being created, and you can see that finally the mature oncogen is developed and finally creates a abnormal growth of tissue. So here the as we are concentrating on the genetic aspects. So what are the gene which will be involved for developing the cancers? So RBI gene involved will be causing inherited cancers such as retinoblastoma, which is occurring in the eye, or might be it is non-inherited, that is many different cancers. It is not necessary that it only attacks the eye, it can attack anywhere in the body. And the next is P53, which is Eufarman syndrome, which is attacking the brain, spinal cord, and that develops into other diseases. That is, other systems are also involved. So, how we can prevent this disease? Elimination of tobacco chewing to the client, total cessation of alcohol, increasing the fruits and vegetables in the diet, avoiding the junk foods and fast foods, which can be a causative factor for developing oncology, stimulation, or mutation. And we have to increase the activity of the client and reduce the exposure to air pollutions or chemicals. We can plan in for any other vaccines or early screening. So, in early screening for females, we usually advise for breast self examination. So, when you go through this breast self examination, the steps and sequences are very clear and how it should be done, which is the most predominant type to be done. Everything is given in this particular picture. So, this breast self examination and testicular self examination will play a major role in screening the client for either breast cancer or testicular cancer. So, early we screen, we can plan in for surgical intervention and prevent the metastasis, that is, transfer or the spread of cancer cells from one side to the other side. So in this picture you can see the testicular self-examination where it is given in sequential order from steps 1, 2, 3 and 4. So in the first step what the client is being advised is that to cup one testicle at a time by using both the hands bilaterally and palpate for any lump. And in the second step we are asking the client to examine by rolling the testicles between the thumb and the finger using mild pressure. And in the third step, we are also asking the client to familiarize with the spermatic cord and the epidermis. And in the fourth step, we ask the client to feel for the lump changes or any other significant growth changes in the testicles. Some of the other early screening would be screening for occult blood, might be in case of a GI cancers. So, occult blood is something hidden blood in the stool. So, either we can plan in for Guaic smear test or fecal immunochemical test, or we can plan in for flushable reagent pad. So, these in this picture you can see how the sequence goes on and how they are analyzing the test and how they are performing the test, and the results are very immediate. In some of the test is very like fraction of seconds you get the result and we can go in for some planning for intervention. Other studies such as GI studies to identify whether the child or the adult is suffering from any upper GI problem or lower GI cancers, just we can plan in for endoscopy. So endoscopy is a non-surgical procedure that can be used to examine the digestive tract, either upper or lower digestive tract, by using the scope instruments. And most of the client may not need general anesthesia. Local anesthetics, viscous or fluids will be given, and the full GI will be numb, and then we start in with the procedure. And to screen whether the child or might be the woman of reproductive age who are high risk for developing cervical cancer, we can plan in for a pap smear. So this pap smear is a procedure where they are going to place the breast. So you can see in this picture, one proctoscope is being placed inside, and then after that might be we can use sim speculum or vaginal speculum. Once the speculum is being placed, along with that we put into the pap smear brush and slowly in a rotatory direction we take the cytological samples. The patient may not get hurted, but there might be mild discomfort, so you will be explaining the procedure in prior before starting the procedure. And of course the patient must go for their emptying of bladder. The other screening markers would be cancer markers such as screening for AFP, PSA and CEA. What is AFP? AFP is the alpha fetoprotein, PSA is prostate specific antigen, and screening for carcinogenic embryonogenic antigen. So here these studies will help us whether the fetus is being or highly risk for developing cancer, or even the adult are highly developing for cancer risk. So the common surgeries, yes, surgery can be performed in all cancers except all the hematological cancer, which cannot be performed by surgery because it's involving the fluids, right, and it moves all over, and it also involves the lymphatics. So, and the surgery is like we can plan for even metastasis or benign tumors. and it can be done as a curative aspect or might be as a palliative aspects. The next therapy which we plan in for is that radiation therapy. So in this radiation therapy, you can see on the left side the two pictures are the external radiation therapy and internal radiation therapy. So in external radiation therapy also you have very varied types of therapies. Please go through those therapies. And here the treatment is given by passing powered X-rays to kill the cancer cells. And when you see the internal radiation therapy, so external radiation therapy we plan according, like if it is prior to surgery, after surgery, or as a reduction in the size of the cells, might be palliative radiation care. So accordingly we plan for external radiation therapy. In internal radiation therapy, you will be having two major types. One is brachytherapy and systemic therapy. Brachytherapy, in that we are going to place the solid radioactive isotopes into the tumor, and the patient will be liable to emit the rays externally. And systemic therapy is a liquid radioactive material through which the blood is through the blood, and we are going to find out and destroy the cancer cells. So some forms are in viscous as well, that is they can just swallow the anti-cancerous medicines in the form of viscous. The next important therapy which we focus for cancer patients is chemotherapy. So chemotherapy is a treatment of cancer where we are going to use chemicals and kill the cancer cells. The therapy used here is like we can plan for induction therapy, that is as an initial state we can do it, or it is a combined modality chemotherapy, like along with chemotherapy surgery can be planned. Consolidation therapy, combination of chemotherapy, that is different drugs you can combine into, or a palliative chemotherapy. So here I have given a list of chemotherapy drugs, what to which cancers we can plan, and what is the acronym, that is a short form of all these drugs. So for example, you can see breast cancer, we can plan in for cyclophosphamide, methotrexate, 5-fluorouracil, and vinoribene. So these are the possible chemotherapy agents which we can plan in for before starting the chemotherapy by according to the diagnosis of the patient, and the doctor would be giving you the order. According to the doctor's order, we give the chemotherapy. Other therapies along with the chemotherapy are immunotherapy and hormonal therapy, as well as you can plan in for medication, that is angiogenesis inhibitors. So these inhibitors will be blocking the growth of new blood vessel, and it also slows the growth of the tumors as well. So we either call it as anti-angiogenic agents. And the last therapy would be planning for organ transplant. So if all the other measures fails, might be we can remove that particular organ and or that particular decayed tissue, that is the cancerous tissue, and replace with a new one. So to summarize, cancer is a large group of disease that can start in almost any organ or any tissue of the body when abnormal cells grow uncontrollably, go beyond their usual boundaries to invade the adjoining parts. That is, they spread to other sites as well and develop the growth of the tumors. So here the cancers must be early screened, because earlier we screen, earlier the prognosis and the recovery of the patient, or the lifespan of the patient can be easily enhanced to a higher extent. Cancer, to conclude the topic, cancer is most likely to be treated effectively, and they have better chance of survival if it is being treated earlier, as I told you. An early diagnosis with it identifies a symptomatic cancer, while screening identifies people with abnormalities that may indicate cancer or pre-cancer, or if they don't have symptom also. So some of the cancers they don't have symptom, but if they go for a screening test to find out whether the oncogenic gene is present in their bone marrow, we can easily screen those child and prevent the earlier aspects. Like for example, if lung cancer the child is easily developing, we can ask the child when before they go into the age group, that is adolescent or adult age group, we can give the alarm signals that your parents, your grandparents have been suffered with lung cancers, and we also saw a test on the lung cancer gene. We found it is highly positive. So that particular child can be prevented from or quit the smoking itself. Like through these sessions, you would have now able to know how to define cancer, what are the possible therapies in cancer, and so on. So these are the common references for the topic, that is familial cancer. So if you have any other queries regarding familial cancer, please don't hesitate to put your suggestions in the comment box and give me your valuable feedbacks. So last but not the least, a big thanks to your patient listening, which is majorly giving me impact and boosting me to do more and more videos. So please suggest me what are the videos you wanted in the future session, so that I would be able to bring out all as per your expected expectations. Thank you all once again. Thank you.